Many of the points that I'm going to bring up today have already been brought up by Kiati and Ingrid, so I really just want to echo a lot of what they've already told us, maybe how it spans across all the different disciplines. The same themes are coming up, and these are kind of the points that we discuss a lot, or that parents ask us a lot about when we're meeting with them in our consultations. And do I need to see a doctor or specialist with expertise in 22q? And at least, from the medical perspective, as well as psychiatric or for psychological evaluations and cognitive testing, you don't. No. I mean, you need to be able to be with someone who you can partner with, as Kiati mentioned, and that you also bring something to the table. You are an expert as well also. And at least from the medical's perspective, your primary care provider or your cardiologist or your specialist in any different area may not know everything they need to know about 22q, but they certainly have the tools available to be able to help treat a child with 22q. And what you can do is help make that catch-up or learning curve for them, narrow that gap for them. And so there are a lot of different resources out there. From the medical perspective, we have a DVD that's online as well that we brought up that has kind of a longer explanation of things that should be done as part of medical surveillance, things that only need to be done once, like maybe the heart evaluations, as opposed to things that might need to be done yearly. And then also from the 22q consortium in 2011, they also printed out a nice paper about practical guidelines. So that's another thing you can bring to your physician, and most professionals are open to learning more and doing what they can to take better care of you and your child. As Ingrid mentioned, when we're talking about a lot of behaviors that we see or difficulties, with the deletion, sometimes you need to think a little more broadly that there can be medical issues like fatigue, maybe due to thyroid problems, or maybe due to anemia or other things like that, in addition to taking a look at what's going on in the environment. Nosebleeds, for example, or problems with bleeding, specifically in the deletion, we know that they may have a higher rate of, platelet problems or other bleeding factors. So those are a little bit more of a special case in the deletion. Sleep problems also come up as areas that are commonly affected. And again, searching for a medical cause in addition to what else may be going on in the child's life. Recurrent infections, again, should be thought about specifically in 22q, and growth should always be monitored. Another big topic that comes up is how and when do I tell my child that he or she has the deletion? And there's no cut and dry black and white answer to this. I think generally speaking, the common themes are that, when your child is showing interest or curiosity in certain things, that's a time when we need to start thinking about talking about the deletion. And in general, earlier rather than later tends to be an easier process. Now, by earlier, I don't mean, from the very beginning, you're telling your child what genetics means and chromosomes and things like that. But children are very aware sometimes of difficulties they may be having. And at least having an explanation that's developmentally appropriate for how much they may want to know can be almost a relief for them to understand that maybe some of the reasons why I have problems with math, despite the fact that I work so hard, is because I'm like other people that have the same problem. And we often talk about telling children about the deletion in the context of strengths and weaknesses, and that this isn't always a negative thing. And just like, Uncle Bobby that that has a really hard time with, his singing voice, and he's not that great at that. Being able to explain for that child that you're not the only person who has problems or difficulties, and there's actually some really great resilience factors that you can learn from it. A lot of our children have wonderful senses of humor. They're very social, and there are a lot of positives and negatives and strengths and weaknesses that go along with the deletion. And this has already been brought up, I'll just touch on it briefly. Unidentified anxiety can manifest in different ways. And so as we were talking about the different labels that individuals may start to get over time, anxiety or oppositional defiant disorder or ADHD, focusing on the label might not be quite as helpful as figuring out what the behavior is and the root of it and why. So we may see things like avoidance or withdrawal because a child's anxious or worried about something. Again, oppositional behaviors. We see a lot of children that come in with a diagnosis already of oppositional defiant disorder, and we sit in our staff meetings and say, how could this child, I mean, this child was just so cooperative the whole time. How did this child ever get that label? And being able to look at that in the context of, well, that child got that label because it's school, you know, they're not engaging and doing their homework, and that's being seen as oppositional. When in fact, you take a closer look and you see that, well, they're having difficulties with, you know, addition or subtraction or spelling, and taking a closer look at the why and the underneath and undercurrent of explaining it can give you a lot more information. And then also tools for treatment, as opposed to just saying he's oppositional. We can't do anything about that. Inattention also, if you're too busy, worried, and preoccupied thinking about something else, then you're not able to have all of the learning experiences that are available to you. Somatization is another big area that we see come up in conversations. So that is kind of physical complaints that are probably anxiety driven, so headaches or stomach aches, pains, things like that, that aren't necessarily due to a medical condition, but is the body's way of expressing some anxiety. And then a lot of repetitive questioning that I know a lot of our children tend to be a trait of theirs. And a lot of that might be due more to not being kind of trying to push buttons or be annoying, but because they're having problems organizing themselves in time and trying to figure out what's coming next, sometimes it's a way of organizing themselves and reminding themselves, as well as maybe working out some worries or anxiety they have about something coming up. And as Tony alluded to, you know, autism symptoms and social competency, that often comes up as a big topic of conversation for our families. And it's kind of a tricky topic here, because certainly a lot of our children have some, you know, social deficits, sometimes social delays, or that they have a hard time getting along with others. But certainly when we meet with them, they're quite sociable, socially engaged, interested in other people. And so why is there this difference in the literature where you have up to 50% of children possibly having a label of autism? And probably the reason for this is, as Tony showed you, is that, you know, just based on the surface measurements, looking at just one part of the assessment, or just looking at screening tools rather than the whole diagnostic assessment, children are coming up high. But if you look at the full picture, certainly not 50% of children are having a diagnosis of autism. And as I mentioned, you know, some social skills, they may be due more to developmental delay, not being in your optimal environment, as everyone talked about earlier. Sometimes language difficulties and not being able to express yourself in the appropriate way leads to behaviors that look like I'm not interacting, I'm not thinking about your feelings, as well as concrete thinking and anxiety. And I think this is important because the most appropriate treatment is going to be what the core is for why those symptoms are occurring, not just the surface of what you see. And then this, really everyone else has said already, setting appropriate expectations. That's a really difficult, it's very easy to say just as a sentence here, but it's really hard to know sometimes what is the appropriate expectation for a child who you know has some difficulties in certain areas, but you don't want to have to support and scaffold so much that then they're not going to take initiative to be able to take care of themselves and lead a more independent life as time goes on. And so that's when it can be really helpful to work with your professionals who are part of your team, where you're both giving input into what is the correct kind of balance that you have between what this child is capable of and what you should expect and what they're doing. And so the take-home points I have before we open up for discussion is that you know your child best, so you really want to partner with your provider in creating a plan. You definitely respect your provider's expertise, but you need to know that you also contribute a lot by providing what you know about your child and by providing resources for them so they can be educated. And rather than focusing on a label or diagnosis, try to figure out the why of why behavior is there and what changes can be made to improve that situation, not just, you know, kind of throwing medications on because these letters are present. And so I think that is all I have to say here. And I just want to say also that in the past, it's been so helpful having all of the family members here, especially families with children who are adults now, because they provide a lot of useful advice and experiences that they've had, and they're also a great resource to learn from.